Hi guys, my name is Jacob. Today my group are gonna introduce you how to remove a GP tube and then how to remove a staple, and I will be filming all of the process.
Hi, my name is Shiromi. I'm going to remove the JP tube.
Hi, my name is Joyce. I'm going to show you how to remove staples from the incision.
Hi, my name is Mary Lou and I'm doing the documentation.
Hi, my name is Joyce and today I'm going to show you how to remove staples from the incision. First, you have to, as soon as you walk into the room, you have to make sure that you introduce yourself and check for 2 identifiers on your patient. The best thing is to check his armband. You have to check for his name and his date of birth. After that, you have to make sure that you have the doctor's order with you and review the procedure with the patient. And also, you have to check if the patient has any allergies. After that, you have to assess if the patient's pain level and ask if he needs some medication. And if he does, you have to make sure that you administer the medication 30 minutes before the procedure. Now let's start with the procedure. First, I want to show you what I have. In here, I have my sterile gloves, my staple removal kit, my dressing, my staple extractor, a normal saline, and my gloves. First, you have to position the patient in a proper and comfortable position and make sure that there's enough lighting. And don't forget to clean your hands before. I'm going to open up the drapes to expose the incision. The patient has the incision in left upper leg. First, you have to make sure that you have a proper clean glove to expose the wound and to do some palpation and some inspection of the wound. To expose the incision. You have to carefully remove the dressing to make sure that it's not painful for the patient. After you remove the dressing, you have to make sure that you inspect the old dressing. Make sure that there's no shadowing or any drain on it. And then you have to inspect the incision. You have to palpate if it's necessary, just to make sure that the patient has that there's no pain, there's no redness, and then there's no inflammation. To open up my sterile kit. Making sure that I don't touch my sterile field. And then I can put some normal saline. And then I'm going to open up my dressing and put it on my sterile field. This is my staple extractor. Now I'm ready to put on my sterile gloves. sure that I don't break my sterile field. Clean the incision. In cleaning the incision, I have to start from proximal to distal, and I start from the side away from me. And then you have to discard the first gauze and move on to the next one until you're finished cleaning the whole incision. Now that I'm done cleaning my incision, I have to make sure that I inspect the incision and make sure that I counted all the staples. Now I'm ready to remove my staple. First, you have to put the tip of your extractor underneath the first staple. Then you have to close the handle until both ends of the staple are visible. Then carefully lift your extractor away from the skin and put the staple. Now that I removed every second staple as doctor's order, I inspected the wound, and the wound was approximated and there's no dehiscence. Now I can continue on putting on my dressing. I am using island dressing. Making sure that the incisions are all well covered, and then I'm going to sign it and date it for future reference.
So your next step on your JP removal, you're going to do your documentations. The first thing you need to do is you need to record the time of the JP removal. You need to record the amount that you remove from the JP drain, the color and the odor of the drainage. You also need to record the appearance of the insertion site, and you also need to record the patient's level of pain. And if you find any evidence of purulence and patient's severe pain, you need to report it immediately. And that's the whole process of JP removal. The next step that you're going to do is your documentation. With the staple removal, you are going to record the time the staple was removed. You are going to count and record the number of the staple that was removed. And then you are going to record the appearance of the wound. You also need to record the level of healing of the wound and the type of dressing that you applied. If you find that the incision has dehisced, or if you find any signs of infection or bleeding, then you need to report it immediately. And this is the whole process of the staple removal. Thank you.